Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. You're with ITV's Medicine of the Prophet, your guide to healthy living. I'm your host, Farouk Hussein, and this is episode 18 of 20 episodes. And in this episode, we'll be looking at ethics within the context of prophetic medicine. In this episode, we'll discuss then the medical ethics from both the current medical practices as well as the prophetic medicine tradition. In this episode, we'll raise questions on and hope to answer them, and they include: what might be the medical ethic guidelines in Tib al-Nabawi or prophetic medicine? And how should a doctor and patient relationship be evidenced? And what should this relationship be from a consumer or client-patient perspective? To discuss this topic, I'm very pleased to be joined in the studio with Professor Rashid Bhika and our guest, Dr. John Glynn. This segment then will provide an introduction on medical ethics within the context of Tib al-Nabawi. Let me draw in Dr. John Glynn and ask Dr. John Glynn, what do we understand, Doctor, by medical ethics?
Well, you know, Farouk, ethics really is what is right and what is wrong. It's really about that. Medical ethics really refers to the relationship between the person and the doctor, or the person and society, or the doctor and society. Those are the three major aspects of medical ethics. First of all, we've got the physician-patient relationship. Now, there's a whole shopping list of things which define this. We've got, for example, medical treatment should act in the best interest of the patient, not the doctor's pocket. It should respect the dignity of the patient in terms of treatment for things like cancer, for pain relief, and for, in the very contentious one, the subject of abortion. They've got to be honest when discussing the outcome of treatment and prognosis of the disease itself. We have to ensure that the person, the patient, knows exactly what he or she is letting himself or herself into. We've got to define what ethics is in terms of end-of-life care, which is a very contentious issue these days. We've got to make sure that experimentation doesn't happen without the knowledge of the person who must receive informed consent. We've got to, and there's a whole range of other things. As far as the physician is concerned, we have to accept responsibility. He's also got to accept the fact that the patient is not always stupid, and maybe he has something to contribute to the diagnosis, to the treatment, and maybe the continuation of treatment afterwards. We've also got to accept that the patient has to accept that some form of payment is justified, although excess, obviously, he has the right to query. In terms of the society aspect, then the patient must have access to medical records. There must be equality of access for the patient, and we also must be fairness regarding scarce resources, regarding pharmaceutical investigations, tests, diagnosis, etc. So it's a whole panoply of subjects which each in its own right can be discussed at great length.
So what is and what ought to be, there seems to be a huge gap. And there's very transformative ideas that you have suggested. And I would now like to ask Professor Bhika, how would you then describe, mindful of what Dr. John Glynn has just said, how would you describe, sir, the ethics within the context of Tib al-Nabawi medicine?
Faraj, Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. In fact, everything that John has mentioned has been encompassed within the ethics from a Tib perspective, and well documented, well studied, well researched in the books of Abdurrahman Sayyuti and Ibn Qayyim al-Jawziyya as well. So, but there are one or two aspects which I think from a Muslim point of view, from a Sharia point of view, from the Islamic point of view, which needs to be really emphasized. Firstly, the doctor's profession is a very noble profession. And not only is it noble, but it also has community responsibility, because it is necessary in any society. And so this aspect about community involvement, community responsibility should become part and parcel of the understanding of becoming a medical doctor in the first place. Right? Secondly, also from the Islamic point of view, any medical doctor should have knowledge of spiritual aspects and psychological aspects. Because from a tip point of view, remember we talk about healing of body and soul. And the soul can only be healed if the medical practitioner has got knowledge and is aware of the concept of spirituality and the significance that it has in health promotion and, of course, if not well managed, in the cause of disease. Then the other aspect is the use of haram ingredients, for example, alcohol, etc. So this also is a very important component as far as Muslim practitioner is concerned. And finally, this I found very interesting, that so much work was done by muhaddithin and scholars about the liability of a medical practitioner. And it is quite clear that if negligence is there, in fact, according to Sharia and the scholars, compensation or diya has to be paid. In other words, if a medical practitioner does anything wrong, definitely negligence, he has to pay diya, he has to pay compensation, either him, his family, or in an Islamic state, the Baitul Mal or the purse, or the government purse, money has to be taken from there to compensate. So the aspect of liability is very serious. Also, and finally, this is very important, if this is not done, then as a medical practitioner, you are answerable. In other words, if you don't pay here, you pay there. So, this is quite a serious obligation and a very, very serious responsibility. And, and I said in the research I did, I found this to be quite, I would say, almost scary. That one has to be very, very cautious when you take on this field of becoming a healthcare professional. Know the responsibility from the community point of view, from the liability point of view.
Wonderful, Professor Bhika. I'm at the risk of losing my job as a host here because I'm so entranced by both Professor Bhika and Dr. John Glyn's comments. Certainly one has a sense of a culture of accountability in this world and for the year after as well, and that you can't deify yourself as the great healer. After all healing does come from Allah subhanahu wa ta'ala. We'll be going for a short ad break now, but still to come. In the next segment, we'll be looking at the current Hippocratic Oath and how this oath is interpreted in Tib al-Nabawi medicine. We'll continue this discussion immediately after the break. And be with us, and we'll be back in a short while. Welcome back. You're watching ITV's Medicine of the Prophet. If you've just joined us, we are looking at the whole question of Tib al-Nabawi and ethics in Tib al-Nabawi. I'm your host, Farooq Hussain, and with me in the studio is Professor Rashid Bhika and our guest, Dr. John Glyn. In this particular segment, we'll be focusing on the current use of the Hippocratic Oath and how this oath is interpreted in Tib al-Nabawi. Let me draw in Dr. John Glyn and ask Dr. John Glyn. Now, Dr. John Glyn, all of us are aware, sir, of the Hippocratic Oath, and you alluded to that earlier on, and also Professor Bhika. And we know that doctors have to take this oath. Can you tell us the content of the current Hippocratic Oath?
Well, Farooq, Hippocrates who's often called the father of medicine, lived about 2,500 years ago. Yes, and he actually brought medicine out of the time of superstition and magic and witchcraft into the rational, almost scientific age. He's noted very much for his oath, which even today conventional doctors and other healthcare professionals actually adopt and adhere to. Let me go through one or two of his major points. First of all, he organized medicine into a profession. He made sure that the training and the registration of doctors was carried out. And remember, we're talking about 2,000 plus years ago. He was also very much involved in documenting previous experience in the medical field. He ensured that the legacy of medical practice was carried through from generation to generation. He also brought in the idea of sharing information with other doctors. He was very much against this idea of keeping things to yourself, that things should be shared for the mutual benefit and for the benefit of the community. He also brought in the idea of only acting in the patient's best interest, that the patient should be given the best of treatment available at the time with the resources open to him or her. He regarded medicine as an art rather than a science, which is now re-emerging as a powerful concept in modern medical treatment. He actually made his most famous statement is, and I quote, "Life is short and the art is long, the occasion fleeting, experience fallacious, and judgment difficult." And this encompassed the whole approach of the medical practitioner to dealing with the myriad of diseases which were around at the time. He saw the patient, the relationship with the patient, as a very important aspect. And he actually suggested, and he believed in very strongly, that it's better to know more about the patient than about the disease the patient has. He felt that the clue to healing by the practitioner is improved by knowing more about the patient, and things which later became known as the temperament of the patient. He very much advocated healing by supporting the inner doctor, as we now call it, or physis, or the power of inner healing. So all in all, he brought a huge amount of value to medical practice in the Western world, and of course in other areas where they practice conventional medicine. This has been present in other areas for a long time, but is obviously very much dominant theory and practice in the present day world.
Well, certainly ahead of his time, because he placed the customer first, or the client or the patient first.
Indeed.
And in fact, the duty to care is uppermost in the practice.
Oh, indeed, yes.
So I'd like to turn to Professor Rashid Bhika now and ask, is there any reference to the practice of the Hippocratic Oath in Tib al-Nabawi? Does it find a good conceptual home in Tib al-Nabawi?
Again, Farooq, absolutely. I'm going to quote from Suyuti's books. And this is what is mentioned, where he talks about the role of a physician or a doctor. And he quotes specifically Hippocrates. And in fact, this is something which I should also mention, that Muslim contribution to healthcare, they always gave credit to the Greek contribution. It was not as if information was turned around and made as if it came from Muslims. They always gave contribution to the forerunners or the previous people who brought about whatever science it was. Anyway, in Suyuti's book, Medicine of the Prophet, he talks about the role of a physician, and quoting from Hippocrates, and this is what he says, that a doctor, he must not go in search of excess. Again, you're talking about what the personality or the attributes or the characteristics of a medical practitioner should be. John has touched on all the scientific basis and the principles of cause and effect, etc. But this is what is mentioned. The doctor, he must not go in search of excess, idling away his time in pleasure, sleep, eating and drinking or play, but he must be eager to treat the poor and the people who have nothing. He must be gentle in his speech, kind in his words, and near to God. This is what Hippocrates said, and he was not one of the believers. This is an exact quotation from Suyuti's book. So again here, first of all, they acknowledged and they took all the information from Hippocrates and they built on it. Obviously, Hippocrates being Greek, there was attributes to the Greek gods, Apollo and all of those things. Obviously, from an Islamic point of view, all of that was left out. But the content of it, the message of it, the importance of it, that was reiterated, re-emphasized, and obviously built on. So absolutely, a lot of what Hippocrates, who brought, and as John mentioned, took away magic and superstition and put medicine onto a scientific basis. This is what Muslims use as the basis for the development of medicine during that golden age of 300 to 400 years, where Muslim contribution to medicine was.
Well, gentlemen, thank you. You've been very good to bring a crisp understanding on the issue of, ethics, in particular with how the Hippocratic Oath is echoed, in fact, in Tib al-Nabawi medicine. Seems as if the doctor and the patient mustn't think they're alone. They also have God watching over them and closer to them than what they think they are. We'll be going now, folks, for a little ad break, and still to come. In the next segment, we'll be looking at the doctor-patient relationship in current medical practices, as well as the doctor-patient relationship in Tib al-Nabawi. We'll continue this discussion immediately after the break. Be with us, and we'll be with you soon. Welcome back, and thank you for staying with us. You're with ITV's Medicine of the Prophet, your guide to healthy living. I'm your host, Farouk Hussain, and with me in the studio is Dr. John Glynn and Professor Rashid Bhika. Just a reminder, in this segment, we'll be looking at the doctor-patient relationship in conventional medicine, and in particular in Tib al-Nabawi practices. Let me direct my first question then to Dr. John Glynn. Dr. John Glynn, there are so many conflicting views on what a doctor-patient relationship should be. Of course, you've presented and outlined the ideal relationship together with Professor Bhika. What are your comments on this relationship that doctors have with their patient currently? I mean, many doctors, you'd wish, they would really jazz up their bedside manners.
Yes.
Yeah.
Farouk, very important question. From the personal point of view, what I would like from my doctor is an adult-adult relationship rather than the paternalistic parent-child relationship. I would like my doctor, ideally, to listen to me actively regarding the condition, previous treatment, and opinion about how it can be approached and how it's going to develop. Next, I would avoid him sending me in for unnecessary diagnosis, over-servicing the condition with too many drugs, maybe too much of involvement, not allowing physis to operate. I would like him to accept that there are alternatives and extra forms of treatment other than conventional medicine, that herbal products, that other hands-on therapy could be used to improve my particular condition. I would also like him to talk about lifestyle changes. I don't lead a particularly wise lifestyle, but I would like him from knowledge to advise on how I should regulate or change my immediate lifestyle. I would like him to spend more time explaining what the treatment is, what to expect in terms of improvement, and what to expect in terms of side effects if, especially, conventional medicine is used. So there are lots of boxes to tick off. The ultimate story is I would like him to respect me as a person, to accept my dignity, and to treat me accordingly.
What wonderful transformative ideas you have presented there. And of course, well-set people like myself are the ones who talk about poverty, but therefore there's a need for lifestyle changes.
Yes,
and I particularly like your idea that some doctors tend to over-service the patient with excessive medication.
Yeah.
But let me turn to Professor Bhika and ask, what does the prophetic medicine have to say about the doctor-patient relationship, sir?
I think most of what John mentioned was obviously advocated in prophetic medicine. And however, as I always do, let me just quote again from Sayuti.
Yes.
With respect to the doctor-patient relationship and with respect to bedside manner. And where he says, positive sentiments that will invigorate the patient's soul, strengthen his constitution, revive his strength, and increase his innate heat. This highlights the fact that this approach towards the restoration of the soul, restoration of the self and the constitution is absolutely important. So in terms of the bedside manner, providing comfort onto the patient is absolutely essential. So again, without repeating what John has said, this is a small little excerpt from Sayuti's medicine, where again the bedside manner is encompassed. Remember, from the two point of view, illnesses of the soul or the effect of the soul on illness recovery is also a very, very important component.
Okay, in my neck of the woods, many of the doctors would begin with the name of Allah and would actually, in their process, also seek the guidance of Allah subhanahu wa ta'ala. So I really find comfort in that kind of bedside manners. We do have, folks, for you, a short clip which will focus on the notion of what the ideal patient-doctor relationship should be. And this external footage has Sister Lucy Bushell-Matthews, and she shares her insights on what the ideal relationship with the doctor and the patient should be.
Well, as a consumer, I understand that there's a medical principle of first do no harm. And so from that, I would really like to understand what are the risks and the benefits of the treatment that I would be undergoing. And I really want the doctor to be truthful and honest with me so that I understand properly. And another point is that once I understand the risks and benefits, I would like to be free to make my own choice. I don't want to have pressure from the doctor to take a decision in one way or the other. Having said that, I would like to know what the doctor would recommend. I know when I had one of my babies and I got a vitamin K injection for the baby, I found it very confusing, having just given birth, trying to decide what was best for my baby. So I would sometimes like to be directed in my choice. It's very important to me as a consumer that my doctor and all the GPs are being confidential with me in my appointment. We often live in small communities where other members of our community maybe can see us going to the GP, or maybe members of our own family, and they want to know, a little bit nosy as to what this is all about. So it's important to me that I can fully trust the GP not to share any of those details.
Sister Lucy Bushell-Matthews. What a wonderful transformative perspective, really leading the field in declaring to the world what the ideal patient-doctor relationship should be. Now let me draw in Dr. John Glynn here and ask Dr. John Glynn, any closing thoughts on this important topic, which obviously impacts on the professionalism of doctors and the healing power subliminally that it will have on the patient?
Yes, I would like the doctor to have a positive and realistic approach to my disorder. I like to come out feeling better than when I went in, knowing that things were going to improve and that the doctor was familiar and on top of my disorder. I'd like to have greater confidence in the doctor for future events. I would like him to instill motivation in terms of empowerment to make sure that I took more control over my health, which is, after all, if your health is not good, then nothing happens of any value.
Thank you very much. Professor Bhika, any closing comments, sir, on this important topic of the, bedside manners of doctors vis-a-vis their patients?
I think it goes without saying that the approach, the bedside manners, almost supersedes the actual activities of the medical practitioner, because healing comes from within, and yet that has to be sort of inspired. And this approach of the doctor is extremely important. Of course, having said that, one also has to understand that, the pressures of life, and so one, as patients also, one has to be aware of the very tight schedules that the doctors do have. But I think it's a balance between understanding the relationship between a doctor and a patient, and I think it is important for ultimately, only with good health can we as Muslims perform our duties of being vicegerents on earth. We can only do that if we stay healthy. So, inshallah, we hope that the doctor-patient relationship will be at that level the way it should be, as prescribed in Tibb al-Nabawi.
Inshallah. And I'm sure that when one sits in the surgery and one's waiting one's turn, one will be a lot more patient, knowing that when it's your turn, you will also have a thorough, diagnosis done for you. Thank you, gentlemen, and you've been very scholarly, and I appreciate your research that both of you have done, and for practicing the very first revelation of the Quran, which is read in the name of the Lord that created you. Now, Allah does say also that one should give thanks, and so I want to give thanks to you with an act of gifting, and I have for you, another gift, so that I hope that for summer you'll have a lot of joy in your garden, and so this is for the two of you, and I hope it brings you great joy. In the meanwhile, it's time for me now to tie up the loose ends and to say that in summary and in closing, what we tried to do in this episode, folks, was to look at prophetic medicine and how it has stipulated comprehensive guidelines on the role and responsibility of the medical practitioner with respect to his competency as well as his accountability in this world and in the year after. Tibb al-Nabawi has also provided clear-cut guidelines on the doctor-patient relationship. Now, folks, in our next episode, we will discuss afflictions from the unseen, the ghaib, in our program, Medicine of the Prophet, Your Guide to Healthy Living. From me, your host, Farooq Hussain. Assalamu alaikum wa rahmatullahi wa barakatuh.